First of all, let me introduce our first presenter. All of them are knowledgeable and also expert in this topic that we are going to present. I will invite Mr. Imran Mughal, Tabbahat Institute, Key Performance Indicator and Quality Tools in Cath Lab.
Thank you very much. Myself, Imran Mughal from the Tabbahat Institute, Assistant Head Nurse in Cardiac Cath Lab. So, key performance indicator and quality tools in cardiac cath lab is very much important topic. So, if we are giving our 100%, but we are not making sure that we are giving quality, so the 100% doesn't worth your efforts. So, what is our objective of my presentation would be define KPI and why we are using KPI, characteristic of good KPI, developing a KPI and how you can develop a KPI and quality tools in cardiac cath lab and quality toolkit for cath lab. So the KPI is a quantifiable measure that an organization used to compare performance in terms of meeting their strategic or operational goals. If you at the start of year, you define a specific goal that you are going to achieve. At the end of year, you are going to, let's suppose you are going to achieve time of protocol 100% at the end of year. So you have to develop first a KPI. So KPI would be assessed quarterly, and you are going to assess quarterly with further adding the improvement if you find any lacking in the process. Why use KPI? KPI is important because if you are doing something or you are performing a procedure or like protocols, so you must have to identify if you can identify the effectiveness of the process, if the one you are doing, the accuracy and the actual reflection of the process means what are you doing and what you want to expect from the process, and used to monitor the result of action, detect potential problem and help to improve them. If you got a problem and you want to improve these problems, so you have to develop a KPI so that you can find the lacking within the process, and you can add on, and then again you can put in the process to achieve these problems. Can be used as a tool to improve ongoing process performance. So if you are going to develop a KPI, that must be smart. Means that must be specific, oriented, objective oriented, that must be sustainable and must be measurable, achievable and relevant to your process, and must be time framed, because if you are setting a goal for performance indicators, so must have to assess, must have to bond a time period, or you can assess and you can collect the data for this specific KPI. Effective KPIs have several characteristics. The effective KPI can provide evidence of progress toward achieving a desired result. Measure what is intended to be measured to help from better decision making. Offer a comparison that gauge the degree of performance changes over time. Can track efficiency, effectiveness, quality, timelessness, compliance, behavior, project performance, or resource utilization. And effective KPI are balanced between leading and lagging indicators. So how you can develop a KPI. Before developing a KPI, you have to have a background workup. You have to assess, you have to be done with the need assessment. You have to identify the problem. You have to identify the gap. And then you have to launch the program. Once you got the data, you have to discuss with for example, you are going to discuss with your director or manager of the cath lab, and then you have to communicate formally with your staff, with your team members, and you have to also engage and establish a team which are specifically assigned for regulating the data and entering the data into the KPI system. The next thing is consider automation. So it would be more easy if you go toward technology and you use a sort of application to enter the data, and you can get a pictorial form of outcome, so you can analyze easily over time with the performance of complete year. Once you are done with the approval, the next thing is to measure. So you have to identify that what your objective is going to measure. So then you have to identify the alternate measures. Means if let's suppose you are measuring that the transradial band protocol was reducing proper protocol following was reducing transradial hematoma, but after shifting to the unit, you have got the information that few of the patient have got hematoma. So you have a secondary source of information, like the unit staff will respond to you. So that will be your alternate resource or alternate measurement or metrics. And then select the right measurement for each objective. If you are going to develop objectives, so there must be specific observation or specific measurement for the specific objective. You are not supposed to, like you are working on hematoma assessment or reduction in hematoma, so you have to specify your objective, and your tool for the assessment would be must focused on the hematoma management system. And at the end, you have to define and document. Once you are done with all the process, you have to define like what is the process and what you are going to measure and what is the objective, and you have to formally just put it into the document. Then comes to perform. Once you are ready with your objective, you have developed the objective. You are going to implement that into your clinical setting. After the implementing, you have to, in this process, you have to find the gaps, although you are implementing the process, but you have to reassess the process. If something is lacking there, so you have to again rethink and reinitiate the process, and you have to add a few more things to have a better outcome in the process. And the review, you have to, once, let's suppose you have got a result of 3 months, like quarterly result you have got, but that is like 60%, you have achieved 60% of your goal. But you want to be done with the 100% over at the end of the year. So you must have come across with the problem in the process, so you have to make sure that you are improving the problem which you have been faced in the recent quarterly assessment. Once you improve the problem, you will get 100% over 4 quarters, means over a year. And once you think that the process is sustainable and it's working and you are getting 100% of the process and you're getting 100% outcome, you have to adopt. So if you think that the process is benefiting your patient and you are giving, that's improving your staff skills, or you are also providing a quality care to the patient, so you have to adopt the process. And if you think that the process is not adaptable, you have to again go for the same process. So some proposed KPI which we can use in Cath lab, like the one is Cath lab suite utilization, and the second one is percentage of on-time start, means the procedure start time. Usually we prepare the patient and we have to wait a lot of time for the operator or the person who are going to start the procedure. Patient turnaround time is very much important. The patient is admitting and you are supposed to set a margin of the time that the patient come from billing department to your designated ward and then to Cath lab and then go back to the certain department after procedure. Door to balloon time for primary procedures, percentage of post-procedure excess site complication, device complication like stent fibrosis or restenosis, patient fall, and like you have to reduce the patient fall, so you can develop a KPI for that special indicator. Blue code in Cath lab. Usually in Cath lab we got all the team. We have interventionists, we got anesthesia, we got nurses, we got technologists, and so I think we got team leader, the person who is ACLS certified. So usually we don't announce blue code because you have already team there. So means if you are working in a Cath lab, so you have to show you have been efficiently managing all the things without announcing blue code. Medication error is the major problem. So you can develop a KPI for the medication error. Time of protocol is very much important. Procedure report turnaround time. Usually the patient after procedure get reports after few days, or maybe it takes 1 week or a couple of weeks. So you must have to make sure that the patient get reports soon after they are going to be discharged. So at the same day, it would be better if you give the report on the same day or maybe after 24 hours. Post-procedure follow-up calls, if we are performing a procedure and we are not following the patient, that's mean there is nothing, means you are not doing working under the sequence of quality. Sky recommend that if we are doing something, so you have to follow up the process. Like you have done angiography or angioplasty for the patient, and the patient is discharged. So you have to confirm, make sure that the patient is doing fine and he is good with the all process. Then productivity per full-time employee and case ratio per staff. So the quality in cath lab, there are 3 domains: structural domain, process domain, and outcome domains. Structural domain is including your staff, infrastructure, and funding and quality assurance committees. And process domain include a checklist like worksheet and TR band form. And outcome domain includes procedure-related complications such as contrast-induced nephropathy, bleeding, and morbidity, and patient satisfaction. Quality tools in cath lab: root cause analysis. If you find a problem, so you have to dig down to the root, and you have to find a specific, it means multiple causes, and you have to go to the depth to identify what are the problems and how you can resolve these problems. And this is the example. A focus PDA. That's also a quality tool for a cath lab. You have to find a process to improve, organize to improve the process, clarify current knowledge of the process, understand source of present variation or root cause, and select improvement intervention. For procedure quality, we have continuous quality improvement sessions, which consist of 5 elements, including identification of quality indicators, systemic data collection using standard definitions, data analysis with benchmark to determine area for improvement, development of plan to correct deficiencies, and systemic repeat data collection to determine effect of corrective actions. These all quality tools are recommended by Sky, and we usually follow a few of them. Other toolkit can be staff competencies, credentialing staff, and educating and training the staff, and ongoing assessment for the staff for improvement. References, and thank you very much.